During the pandemic, we are all being encouraged to sleep on it. That's the title of a national campaign from sleep specialists across the country. Joining me from Calgary's Centre for Sleep and Human Performance is Dr. Charles Samuels. Dr. Samuels, thank you for joining us this afternoon.
My pleasure.
Now, with anxiety related to coronavirus, like loss of money, loss of your job, worrying about your health, worrying about your loved ones, how likely is it that people will have trouble sleeping?
Well, as I've been saying in various interviews, is it goes two ways, actually. Certainly, the likelihood of having sleep disturbance is very high in this setting, not only because of the anxiety associated with what futures will hold for people, and also the rigors of having to have kids home all the time and homeschooling for parents who've never done that before, but also the loss of routine. And so routine plays a major role in the quality of our sleep. That would be the downside. The upside is that I'm hearing from people, our patients at the center, but also people in general saying that this is actually an opportunity for them to catch up on the sleep lost because they might have an hour commute and have to wake up at 5. And now they can wake up at 7 and just trundle over to the computer and start working. So there's two sides to the coin here.
I guess there is a bit of a silver lining. Of course, there are lots of items in the pharmacy that promote a better sleep, but you're not advising people necessarily to take over-the-counter medication.
Yeah, we really have a very strong feeling about that. And that comes from many years leading the national committee that developed the guidelines on treating insomnia in primary care. We really educate family physicians and the general public to not go to over-the-counter medications. If you actually have a sleep disturbance, have it evaluated and get some help in a center like you would have across the country, or see your family physician or primary care provider. Certainly here at the center, we see people very quickly, and during this time, certainly frontline people we're seeing immediately to help them. And rather than going to taking an over-the-counter medication, which in many cases doesn't work and also causes more fatigue.
Of course, lots of people working at home are working on their devices, and those devices may carry over into the evening as well. And we've heard about the dangers of blue light from phones and iPads and that sort of thing. When should people put those devices away for the evening?
Yeah, I think this is to me, this is one of the most important things, because now in this setting, our only connection to the outside world, and we're so tied to the devices that we really have to put in boundaries of when we start, how much time we take a break away from the screen through the day, and then setting an absolute cutoff time in the evening. I'm pretty rigid about this. I say, by 5 or 6 o'clock, you should be off your screens. We know that it actually affects people's ability to wind down, and then the natural physiological response for sleep, the rise in melatonin, et cetera, is affected by exposure to the screens. So, sometime in the evening, certainly 1 to 2 hours before bedtime, no screen time, just winding down and letting your body rest, because this is a stressful time and the rest is important for coping.
Of course, we still have the opportunity to get outside and get some exercise, go for a run, walk the dog, ride the bike, even at this time of year. How does that help people with their sleep habits?
Yeah, this is really important, actually, and incorporating into the routine time outside, certainly end of day, post dinner, going for a walk, in the morning, being outside, getting 30 minutes of outside light, which we can do now because it's springtime. All of these things are very beneficial to stabilizing the sleep and feeding routine, which are all driven by exposure to outside light.
Okay, before we go, quick personal question. How much sleep did you get last night?
Well, last night was a bad night.
Really? You too?
But I've been doing pretty good. Yeah, I hurt my ankle running last night. So, but I mean, most of the time I'm an 11 to 7 guy, and I really do. I'm very routine about it. And if I'm tired, like after this, I'll probably shut my eyes for 10 to 15 minutes and then get through my afternoon with patients.
And for the record, 11 to 7 is a full 8 hours. So good on you for doing that. All right. Thanks very much for joining us.
My pleasure. You take care.
You too. And for more information, you can visit centerforsleep.com. They're also on social media via Facebook, Twitter, and Instagram.